Welcome back. In our last lesson, we explored the MH-GAP Intervention Guide, a simple, structured tool for screening depression in primary care settings. We saw how the MH-GAP Guide helps us ask the right questions and recognize the signs of depression, such as persistent sadness, changes in appetite, and feelings of worthlessness. In this lesson, we'll take a deeper look at one of the most widely used screening tools for depression, the PHQ-9. The Patient Health Questionnaire 9 is a self-report assessment tool that helps quantify the severity of depression. It's easy to use and can be administered quickly, making it ideal for primary care settings or community health workers who are working with limited time and resources. What is the PHQ-9? The PHQ-9 contains 9 simple questions that cover the core symptoms of depression. The goal is to measure the severity of the person's symptoms and determine the appropriate course of action. Each question asks about a specific symptom of depression, such as sleep problems, loss of interest, fatigue, and thoughts of death. The person being assessed is asked to rate each symptom on a scale from 0 to 3, based on how often they have experienced the symptom in the last 2 weeks. Here's a breakdown of the scoring system. 0, not at all. 1, several days. 2, more than half the days. 3, nearly every day. Once the individual answers the questions, the scores are added together, and the total score helps determine the severity of their depression. What do the scores mean? The total PHQ-9 score can range from 0 to 27, and it helps guide treatment decisions. Here's a general guide for interpreting the scores. 0 to 4, minimal or no depression. 5 to 9, mild depression. 10 to 14, moderate depression. 15 to 19, moderately severe depression. 20 to 27, severe depression. A score of 10 or higher usually indicates that the person may need further assessment and potential treatment. How do you administer the PHQ-9? 1. Ask the individual to fill it out. The PHQ-9 can be self-administered, which means the person fills it out themselves. This can feel less intimidating than a face-to-face interview and provides more accurate responses. 2. Review the responses together. If the person cannot complete the form on their own, or if you're in a more interactive setting, you can go through the questions together. Afterward, discuss the answers and calculate the total score. 3. Interpret the results. Based on the score, decide on the next steps. If the score suggests moderate to severe depression, the person may need immediate referral for professional treatment or more intensive support. 4. Follow-up. The PHQ-9 can also be used to track progress over time. You might ask the person to fill out the form again after a few weeks to see how their symptoms are changing. Let's pause here for reflection. Think about a time when you've had to assess someone's mental health, whether formally or informally. How might using a tool like the PHQ-9 help you understand their experience more clearly? It's not about labeling someone. It's about providing the right kind of support based on their actual symptoms. A real-world example. Tunde, a 40-year-old father from Lagos, comes to a health clinic feeling unusually tired and disengaged. His wife has noticed he's been withdrawing from family activities and working longer hours to avoid going home. A nurse uses the PHQ-9 to assess his symptoms and learns that Tunde has been feeling sad, lacking energy, and experiencing sleep problems for over a month. His total score is 18, suggesting moderately severe depression. The nurse explains the results to Tunde and his wife and refers him to a mental health specialist for further care. By using the PHQ-9, the nurse was able to pinpoint the severity of Tunde's depression and make a well-informed referral. In summary, the PHQ-9 is a simple, effective tool for assessing the severity of depression. It consists of 9 questions, focusing on key symptoms like sadness, fatigue, sleep issues, and thoughts of death. The total score helps determine whether the person's depression is mild, moderate, or severe. The PHQ-9 can be self-administered or used in an interview, making it accessible for non-specialists. In our next lesson, we'll explore clinical interviewing and patient history taking, the skills you need to gather comprehensive information during a mental health assessment. We'll talk about how to ask the right questions, build rapport, and create a safe space for the person to share. But before we move on, here's your reflection. If you had to use the PHQ-9 with someone in your community today, how would you make the process feel supportive rather than intimidating? Let's continue learning, and remember, the goal is always to help the person feel understood and respected.